In this video, we are going to perform a basic head-to-toe assessment. Prior to the procedure, you need to follow these steps, and we will be beginning the head-to-toe assessment.
Good morning, Mr. Time. How are you doing today?
Good.
Great, it's good to hear. Can you give me your name and date of birth?
Just in time, 10/15/69.
Wonderful. And do you know where you are today?
I'm in Firelands Hospital.
Oh, great. What about the year? What year is it?
It's 2019.
Very good. And do you know what season of the year it is?
It's summer.
And it's a warm one out there today. What I'm going to be doing is a basic head-to-toe assessment, so kind of covering from the head down to your toes. Is that okay?
Yes.
Wonderful. First, I'm going to complete a set of vital signs: temperature, pulse, respirations, blood pressure, and SpO2, and complete a pain assessment fully. Okay, Mr. Time. Throughout the procedure, I'm going to be assessing your skin, both on the front and on the back. I'm going to be looking for lesions, wounds, dressings of any type, tubes, drains, etc. Okay, so I'll be assessing that as I go along. Start with your head here. Look behind your ears. All of that looks great. Can you smile for me? And raise your eyebrows. Wonderful. Now, I'm just going to shield your eyes here, and I'm going to check your pupils. So if you just want to keep your eyes wide open. Great. All right. Now what I need you to do is I'm going to have you focus on the tip of my pen, and then when I say, I'm going to have you focus on a spot on the ceiling. So tip of my pen light, ceiling, tip of my pen light, and ceiling. Wonderful. Just going to take a peek in your nose and in your mouth. Are you having any problems with your nose or your mouth, your teeth, your gums, tongue? Any problems there that you're aware of?
No.
No? All right, great. What about your ears?
No.
Great. All right. I'm just going to pinch your skin a little to check your hydration status, and that's very good. All right, I'm going to come over and check your arms here. I'm going to do both sides at the same time for most things. That way I can compare and make sure they're equal. So I'm going to check your radial pulses, your brachial pulse. Great. All right, I'm going to look at your capillary refill. That's wonderful. Assessing the skin temperature, moisture, not seeing any edema of any sort. And can you reach up and squeeze my hands? Oh, great. Good job. Let me look at your skin here. Good. Your elbow looks good. Any problems here when we're doing some range of motion?
No.
Great. A little creaky on this side, huh? Yeah. There you go. Wonderful. I'm going to, if it's okay with you, I'm going to move your gown down and assess your chest area.
Yes.
Okay. Just going to open it a little bit so I can see what I'm looking at here. All right. First of all, do you have any problems with coughing or shortness of breath?
No.
No? Great. Any type of pain in your chest area?
No.
Wonderful. That's what we like to hear. Okay. I'm just going to have you breathe normal for me, and I'm going to listen to your heart. Aortic, pulmonic, tricuspid, and mitral, which is also known as the apical. Oh, that all sounds great. Now, could I have you take a deep breath in and out several times? Listen to 6 areas on the front. I'm going to listen to 1 complete inspiration and expiration in each area. And another deep breath in and out. I'm going to listen in 1 area laterally on each side, always going back and forth in a zigzag pattern to compare. And have the patient roll over on their back, and I'll assess skin from head all the way down to the anal area, and I will have the patient breathe 6 times again on the back. So that was my posterior lung assessment. Oh, that was great, Mr. Time. Everything is very good there. Okay, is it okay if I bring your gown up a little and assess your abdomen?
Yes.
Thank you. Okay. Oh, I see you have a dressing. I knew you were here for surgery. Your dressing looks nice and intact. There's no drainage at all. Skin surrounding looks very good. And it was just done this morning at 6 a.m., so we're well within our time frame. Are you having any issues with your abdomen? Any nausea, vomiting?
No.
Diarrhea?
No.
When was your last bowel movement?
It was a couple of days ago.
Okay. And was it soft and brown?
It was soft and brown, yes.
Oh, great. That's just what we like to hear. I'm not seeing anything on your abdomen that concerns me. I'm going to go ahead and listen to your bowel sounds. You let me know if anything bothers you. Right lower, right upper, left upper, and left lower. Those are nice and active. And now what I'm going to do is just push really lightly and let me know if anything hurts. I'm going to palpate in the quadrants, assessing for any masses, lesions that I feel, any discomfort to the patient. That all checks out well. Your surgery is doing its trick. Is it okay if I look down in your perineal area?
Yes.
Okay, so what I'm going to do is I'm looking for redness, drainage, moisture. There is no Foley catheter present. If so, I would note that. And everything looks nice and intact. Are you having any difficulty urinating?
No.
Wonderful. Are you having any burning or urgency or anything when you urinate?
No.
And have you been able to note the color?
Yes, it's yellow.
Oh, that's great. That's perfect. Just what we want. Okay. Are you going about every couple hours usually?
Yes, every couple of hours.
Okay. We give a lot of extra fluids here in the hospital, don't we?
Mm-hmm.
Is it okay if I uncover your legs?
Yes.
Great. If I had soiled my gloves when I did the perineal check, I would have changed my gloves, washed my hands and changed my gloves. Okay. So let me check your feet here. And I am checking my dorsalis pedis pulses, my posterior tibialis pulses. Great, those are wonderful. Temperature, moisture of the skin. I don't see any breakdown at all from what I'm seeing. Checking for edema. And let's do our capillary refill. Oh, that's nice and prompt. All right, I'm gonna look at your heels. No redness there. Does this hurt at all?
No.
No? Great. Your range of motion is wonderful. And let's check your heel on this side. Any issues there? Everything looks
No.
good. Can you push against my hands like you're pushing down on a gas pedal? And what about pulling back towards you? Oh, great. Nice and strong. Have you had any falls in the last 3 months?
No.
Well, that's good to hear. Do you use any kind of a device at home, such as a cane or a walker?
No.
No? Wonderful news. Okay. I am going to wash my hands, put on new gloves, and I am going to go back and I'm going to check my sclera and my conjunctiva, making sure that my sclera is nice and white and my conjunctiva is pink and there's no drainage. If you do forget something during your assessment, it is okay to appropriately change your gloves as needed and go back and finish what you may have forgotten. Okay, well, I am going to see you later. I'm going to go document and let me know if you need anything.
Okay, thank you.
You're welcome.
Following the procedure, you need to follow these steps, and that concludes the basic head to toe assessment video.